Let me ask you a question. How much control do you have over your health data? Do you know how to use it? Do you care who has access to it? And do you trust that your data is safe? These are just some of the key considerations that went into the building blocks of a landmark piece of EU legislation that came into effect on March 26th, the European Health Data Space, or EHDS.
We are aiming to have actually the bigger repository of health data, not only in terms of quality, but in terms of quantity and in terms of respecting the privacy and the human rights from the very beginning.
The only problem? Well, not many of us even know that the EHDS exists. Well, righting that wrong was the Italian NGO Cittadinanza through its EU branch, the Active Citizenship Network, or ACN, who held an event at the European Parliament in celebration of the 19th European Patient Rights Day to shine a light on the benefits of health data sharing for patients, healthcare systems and medical research.
Clearly, continuity of care, active citizen participation, sharing of data as a public good to ensure timelier, personalized and inclusive care are crucial objectives for the next years of the European Union.
Words echoed by the Lithuanian MP Andriukaitis, who sent a message of support.
Health data sharing, when done ethically and securely, is not just a technical issue. It is a matter of justice and of better care for every patient.
Working across 12 member states and the UK is Profit, a personalised roadmap for the future of healthcare, which is an EU-funded project that aims to create a future roadmap for the implementation of personalised prevention in Europe.
An important gene we know is the BRCA, and in particular the BRCA mutation in BRCA1 and 2, and we know that it increases a lot the risk of developing breast cancer during our lives. Basically, we can find the women at high risk searching for this mutation, particularly the ones that already have, for example, familiarity or other risk factors. And then in these women, maybe, I don't know, the ones that are young, maybe at 25 or 30, we can already implement some preventive strategies.
EU-funded projects like Profit highlight the vast untapped potential of primary and secondary health data. And so for industry, the EHDS could be a game changer.
For decades, we've been relying on the data from randomized clinical trials, which is the data generated in a strictly controlled environment. This is a very ambitious proposal, very much needed. It can be a groundbreaking proposal in the context of its ability to truly create a single market for data.
But ambition cannot be unbridled.
These were the most important things for us to make sure that the data is protected, that the data cannot be manipulated. And of course, the big issue that was almost the reason why the negotiations could have broken down, but they didn't in the end, was the question of the opt-out. So the opt-out, the idea was that for the Parliament to make clear, because in the original proposal that was not clearly prescribed, that those patients who don't want their data to be used for secondary purposes could make such a decision.
And trying to build a framework for trust around health data is the IHI Facilitate project, which aims to develop an ethical, legal and regulatory framework to enable the return of clinical trial data to participants.
There have been instances where health data have been sold to insurance companies, and those instances remain with us. So if you talk about health data, people remember the bad things and they don't look at the good things. But if you make them part of the whole process, then you can build trust.
Another feature that is also important beyond trust is digital literacy of patients.
Recent data show that only 55% of the European population has at least basic digital skills. This suggests that despite improved access to health data, people with low digital literacy may find it difficult to navigate electronic health records, understand the information they contain, or fully exercise their rights to restrict access and request certification of inaccurate rectification of inaccurate or incomplete data.
Putting patient rights at the centre of healthcare has been a core element of the Polish presidency of the EU. So does the EHDS come up to scratch?
There's a lot of work that has to be done. We're just scratching the surface here with the technical aspects and so on. So legislation is there, that's fine, but now basically you have to get back to the drawing board in all the countries and see how it really operates.
Two leading principles emerge from the 19th European Patient Rights Day. The patient needs trust and better communication when it comes to data. There also needs to be the right balance between ensuring privacy and economic interest. Now, the meeting at the Parliament was a great first step, but more needs to be done so that EU citizens understand the European health data space and how they can be in control of their own data.